We're going to get started in just a minute, so if everybody would like to take a seat, please. Good afternoon and welcome. I'm Sheila Johnson-Brousseau, and this is Lily Stamets, and we are the Outdoor Art Club Civics and Conservation co-chairs for today's program. For those of you who are not familiar with the Outdoor Art Club, we are a nonprofit women's philanthropic organization that was founded in 1902 in the heart of downtown Mill Valley. For over 125 years, we have supported care of our natural world, the arts, and civic engagement. Examples of our outreach include providing an annual speaker series like this event today, focused on the arts and conservation engagement, organizing Marin Beach and Riverway cleanups, preparing and serving meals at Jonathan's Place, and providing 2 scholarships for female graduates of Tamalpais High School. Service and community well-being are central to who we are. While our historic clubhouse undergoes renovations, we had the opportunity to collaborate with valued community members to explore new venues and new ways of bringing our series to you all. Today's program was created in partnership with Westminster Events and reflects a shared commitment to offering thoughtful public conversations that support the health and resilience of our community. We are deeply grateful to Westminster Events and Westminster Presbyterian Church for hosting us, to our speakers for sharing their expertise, and to you for joining us today. I'd like to acknowledge the Outdoor Art Club and Westminster Events volunteers who helped put this program on today. So if you're here, if you could please rise and let us acknowledge you for your time and dedication. Programs like these are only possible because of you. Thank you. Following today's program, we invite you to join us in the adjacent fellowship hall for a reception. You'll have the opportunity to continue the discussion, enjoy refreshments, and connect with several Marin public health organizations featured in the back of today's program. Aaron worked very hard getting these organizations here. They're small groups, and they have a lot to offer, so we hope you'll visit. And there is plenty of food, so thank you for waiting. Again, thank you for being part and participating in this important conversation. And now I'd like to welcome to the stage Judith Harkins from Westminster Events to kick off the future of public health.
Hi, everybody. Thank you so much for joining us. And thank you, Sheila, for that nice introduction. On behalf of Westminster Events, or we, as we like to call them, I'd like to welcome everybody here. As Sheila stated, we're really pleased to present this event as a collaboration between we and the OAC. We have many shared members, and we feel like our values align, and we work really hard together on this event. The mission of we is to provide a forum for the sharing of diverse and informed points of view and important issues that impact Marin County. We do this by hosting free speaker programs as well as post-event receptions, and which allow you to converse with the speakers, audience members, and our action partners. During the reception today, we are hosting representatives from Marin Health and Human Services and 5 other Marin-based nonprofits. And as Sheila mentioned, there's more information right here about all of our action partners. A bit of housekeeping. So when you came in, you were given 3 pieces of paper. One is the one with a bio, with the bios and the action partners. The second is a little piece of paper with lines for questions. If you have questions for Lisa, Dr. Santora, you can write them down and then just pass them to the side aisles, and our volunteers will be walking up and down and picking them up. We'll collect them all together for a Q&A session at the end after they speak together. And we hope to get to all the questions, but we may not have time. So just know that we're trying our best to get to all of your questions. And if there's something else that you'd like to know, you can always talk to Dr. Santora in the reception. She's gracefully offered to stay. A second very important piece of paper that you have is our evaluation form. We would really, really appreciate it if you could take a minute at the end of the program to fill out your evaluation and just hand it to one of our volunteers on your way out. At the bottom, there is a line to include your email address, and if you'd like to do that, we can keep you up to date on what's happening with our future series. At last, just one quick thing is to ask you to please make sure your cell phones are silenced. So now that we've covered all that, let's move on to the topic of the afternoon, the future of public health. As someone that has spent their career in public health, I'd like to briefly introduce you to one of my favorite topics before introducing our moderator today. Many of us in this room didn't really think about public health prior to the COVID-19 pandemic. It's something that's gone on in the background, and we didn't really know how things worked, but the pandemic brought some of this to life and to the forefront to the general community. In public health, we see how we can improve health of not just individual people, but whole populations. And by definition, public health is a multidisciplinary field that includes, among others, health professionals, policymakers, community leaders, and the public to create and implement strategies that enhance overall health for our whole well-being in our communities and societies. So just a few examples of what public health does. We design programs for the health of the communities. We try to prevent and mitigate communicable diseases with vaccination programs, health education, monitoring of outbreaks. And we design health education programs to empower people to improve their own health. All of these are just a few examples. In Marin County, we're very fortunate to have Dr. Santora as the leader of our public health division. She'll be talking to us today about some of the most pressing issues for our county and tell us about how she thinks about them and how she thinks that we can improve those. I'll let our moderator, Terry Dowling, give you a detailed introduction to Lisa, but let me give you a little introduction to Terry. Terry graciously agreed to moderate today. It's her second time moderating a WE event, and we couldn't be happier. She's a resident of Ross, and where she's lived since 1991 with her husband, Mel. She began a career devoted to helping others as a Peace Corps volunteer, training teachers in Ghana, West Africa. For much of her adult life, she worked for San Francisco's Department of Public Health, where she held several management and director positions, including directing community health education, HIV counseling and testing, and managing community planning for emergency preparedness. From 2011 to 2024, she represented Ross on the Marin County Commission on Aging, where she served 2 years as the chair. Additionally, she currently serves as a member of the Ross Town Council, so she's a quite busy person. Please join me in welcoming Terry Downey and Lisa Santora.
What a great group on this beautiful Sunday afternoon. It is a pleasure to introduce Dr. Lisa Santora. Lisa serves as a public health officer for Marin County, where she oversees public health emergency preparedness, communicable disease prevention and control, and detention health. She is a seasoned medical officer, public health leader. She previously served as a chief medical officer for the Beach Cities Health District and has served federally qualified health centers across the country. Dr. Santora holds a degree from Rutgers, New Jersey Medical School and a completed residency in both preventive medicine and family medicine. I'm really honored to have known Lisa for a number of years now. Both of us served on the steering committee for the Aging Action Initiative here in Marin County. So please welcome Dr. Lisa Santora. Now I get to ask the questions. And Lisa gets to do all the talking.
I'm on the hot seat.
You are, all right. So Lisa, tell us a bit about your job And why did you choose public health? And what do you do?
What do I was sharing, I go to a lot of meetings. What is my job? My job right now is really envisioning what is the future of public health in our community. We're in this unique time post-pandemic. We have received investments titled Future of Public Health from the state to build up an infrastructure, but what we really are experiencing is that we have a constriction of significant funding into public health, rightfully so, from some people's perspective, but from my perspective, we've seen public health is always underfunded. I'm definitely a believer an ounce of prevention is worth a lot more than ounce of prevention, pound of cure. Ben Franklin, I was down in Philly earlier this year, so I should remember, but an ounce of prevention is worth more than a pound of cure, right? And that's the truth of our healthcare system. We spend about 98% of our dollars on our healthcare system, 70% at the end of life, in the last 10 years of life. And so how can we shift that and start spending earlier in an equitable way, in a fair way, with justice in mind, so we can create healthy communities that support individuals living the best lives they can, wherever they are, whatever age or stage they are in. How I got here, I was a doc. I was a first-generation college student, so I was the first person on my dad's side of the family to graduate college. I'm a very stereotypical Irish-Italian Catholic girl from Jersey via Brooklyn. So if you're familiar with that culture, you'll get me a little bit. I was the third person on my mom's side to graduate college, so really valued the importance of education. And when I went to school, I had the opportunity to go to Fairfield University, which is a Jesuit university, and really saw the value of service. And it was there that I just learned that I was just lucky because of the zip code that I was born into. I volunteered in Bridgeport, Connecticut, which is a very underserved, low-income, predominantly black community in the wealthiest county of Connecticut, in Fairfield County, very much like Marin County. And I just knew it was sheer luck. And so I endeavored to get into medical school because I wanted to change the world. I was very aspirational then. I'm a lot more pragmatic now. And I intentionally went to medical school in Newark, New Jersey. I wanted to learn in a county health system, and I wanted to learn in a low-income community how to provide care. This is all before the Affordable Care Act. And so if you were uninsured, you really had no care. You had no options. Your option was going to a free student clinic, which I worked in, of course. And if you needed additional specialty care, you were referred to the emergency department. And to me, that's a broken system. And so I endeavored to learn the machine so I could figure out how to break the machine and make it better. I went to work for a federally qualified health center. We have 4 federally qualified health centers in Marin County. We have Marin Community Clinics, Ritter Center, Petaluma Health Center, which was Coastal Health for some of you, and Marin City Health and Wellness. And thought I could be the change maker in that space. That's where our underserved and uninsured residents receive health care. And I got frustrated really fast because I learned that it isn't about the treatment that was really affecting most of the lives of my patients. I could prescribe a medication, I could diagnose very well. The reality was that they didn't have the supports and the services that they needed to live a healthy life. And so that's when I started, and it also was before the Affordable Care Act we talked about. And so again, there were no options. There was not specialty care. If someone our only option was the emergency department. And so I reflected and thought about the doctor that I wanted to be, and then I shifted saying I want to be a doctor for a community and to start working on the policies and the systems that could really improve health across the population, and really with a focus on some of our most our uninsured population and underserved populations. So that got me to Beach City's Health District.
Yeah, come a long way. So truly, what do you do? I know you go to meetings.
I go to meetings. I meet. That's a great. So I oversee our core public health programs, and so it's really from A to Z. So it could be from aging to Zika, Some people might remember that. So anytime our core of who we are in public health is communicable disease and emergency preparedness. So if we strip it all back, if you think about any emergency situation in our community, you think about running water, clean water, having your sanitation system in place, and so the core of public health is ensuring that those core systems are in place. And so part of my role is on paper only. So for example, environmental health services is a key part of the responsibility of a health officer in Marin County that lives in the Community Development Agency. So I work closely with them and I advise them, but they're running the show for environmental health services. When there's issues, for example, you may remember that we had a seepage in Bolinas, so there was, that was identified as being contaminated. Then the health officer is called in, and then I'm working to design what is going to be our approach towards addressing seepage into the ocean, which was a very complex situation. So that's one side. The other side is communicable disease is core to who we are. So one of the programs we have many communicable disease programs. One that's very active right now is our tuberculosis control program. So we work with all of our providers in the community, make sure that individuals are diagnosed with tuberculosis and they are treated for tuberculosis, and then they're in isolation. And then we work with a team to make sure they're receiving their treatment every single day. So again, how are we mitigating the spread of communicable disease in our community? Some of my favorite calls are rabies calls. We have a great population with a partnership with Marin Humane, and they're complex exposures. So if you get exposed to a bat or you have been bitten by a dog, you have a team that's working to figure out, do you need to get post-exposure prophylaxis? And a mom first, so the way I role is thinking like, well, would I want to have this post-exposure prophylaxis for my child? Because it's not insignificant. We have our vaccination program, so we have nurses that work with all of our school systems to make sure that the schools are reporting on their vaccines. And you all probably participated in our vaccine program with COVID. So when we were vaccinating for COVID, you most likely received a vaccine that was coordinated or provided directly by our team. So that is an example where we didn't have, we're not a county with our own healthcare system, so we had to build it. So I was behind literally building it, drafting a plan for opening testing at the Marin Center, drafting a plan for opening up the vaccine at the Larkspur, at the ferry landing spot. So Marin Center is, again, we did a lot of vaccinations there. So and on any given day, it's designing that system of care and making sure that it's working and making sure that we are identifying. There's new diseases that are emerging that doctors have never seen before, so we're getting calls about evaluating people for measles, for example. So we provide consultation with our providers to determine if they've had an exposure, if they had an exposure to measles, and help people get tested for cases of measles. So that's the bread and butter. That's not my favorite part of my job, though.
What's your favorite part?
The system design, the policy changes to really create a healthy community. So that's what I get excited about.
That's good.
Thank you, Terry.
I don't think people really understand how big public health is and how much it really encompasses our lives. So collaboration is an important part of public health. So tell me a little bit about how Marin County Public Health interacts with state and federal government.
That's a great question, too. We'll go with state first.
Okay.
The state provides us with guidance. So we are funded through the state. There's California Department of Public Health. There's programs that get funded directly through the state. So for example, we get funding for our tuberculosis program. We get funding for our vaccination program. Really modest funds, they're like $200,000 to $500,000. And then a lot of so those programs is where when there's a state program that we're implementing, we are following guidance from the state and implementing it to fidelity. There's another funding stream that's more important to us. It's from the state, but it's called realignment funding. And so those are they're not general fund dollars, so they're not funds from your property taxes here, but it's funding from the state to implement the core public health and protective services in the county. So it's not just in the public health program. So realignment funding will go to our social services program, our behavioral health and recovery services, and to public health. So our interaction with the state is primarily being responsive to the programs that they are implementing in our county, and we, in fact, are an agent of the state in many ways. So when there was a situation in Bolinas, my first phone call was to the state. Yes, I'm the health officer for the county, but for example, the reopening of beaches and other decisions, we consult with the state and confirm what is the authority of a health officer and making sure that we're following state rules. So we're not making things up. There's health and safety code that we have to follow those rules. So I'm in some ways an agent of the state, ensuring that the health and safety codes are in effect in Marin County, and when they are not in effect, then we're already at X for questions. Wow, that went fast.
What about the feds?
The feds. Well, follow up with my closed loop on the state is it was different during the pandemic. One of the things I was most proud of was Marin County led with creating policies and systems to support the reopening of the county. And we were ready to reopen in June 2020. And then the state came in, which was actually a very frustrating experience because we had crossed all our T's, dotted our I's. We were ready for a full opening of the community. We had our plan for opening schools. The state didn't have a plan for opening the schools. So we were really proud of being ready to open. And then the state came in and shut our approach down. And then it was a state approach. So when you think of purple, red, and orange colors and which color were we in, that was not generated by the county. That was a state mandate. So that's when we had to follow a state mandate. So there are times that I can be frustrated with the state, even though I am an agent of the state. With the federal government, it's different now. This wasn't unexpected. We knew with the new administration that there would be changes, and we prepared for that. We don't reference the federal government often, like we used to. So when we used to see our status health updates, we usually were in sync with what the CDC was coming out with, and we would try and amplify those messages. There's a lot of changes that are happening now with policies and budget at the federal government. And so we worked before the administration ever took power to have our core messaging and principles ready, and then to keep marching forward and staying very focused on what were the communication messages that we want to have, to mitigate the confusion that's being caused by the changes at the federal level.
I just want to remind people, we have a few more minutes that we're going to be talking here, but you may have questions, and if you have questions you would like to ask Lisa, please take the time and jot them down on paper and pass them to the inner aisle or the outer side of the aisle, and somebody will pick them up so we get to ask at least some of those questions. Okay,
I'm ready.
So Lisa, back to you. Is the county experiencing any fallout from changes of policy and funding from the federal government now?
Yes. So we have been experiencing directly since, I'd say, November of last year. Actually, we experienced it early I forget things sometimes. I put things in boxes because it can be really stressful. And so I put things in boxes. So our first hit was with DOGE. The word equity became, they used AI to find any grant funding that had the word equity in it. And one of our important funding streams from the state to support the recovery of the pandemic was called the California Equitable Recovery Initiative. And so that funding was stripped right away. It was about, it wasn't that much. Like, these fundings aren't large numbers, but we can do a lot with a little sometimes. So I want to say we were stripped of around $300,000. So programs were just halted in place until, fortunately, lawyers, I never thought I'd be saying this, but fortunately we have communities of lawyers that are taking action when there are federal changes that are coming down, orders that are coming down. If they are not constitutional, they are opposing them, and we have a very active state in opposing federal actions. And so that was a federal decision that was eventually stayed. Most significant, the other way it's affecting us is it puts us in a reactive space. So we're not in the regular blue sky days anymore. There's always can be like a new messaging or new communication coming from the Fed, so we're often in a reactive state. And then that takes you away from doing the work, the good community building work, because you have to be almost responding into a crisis mode. And then most significantly was what happened with when CalFresh got defunded. So that was in September. And that was again, it's just the politics at foot. So in September, we learned that the government shut down, and so we had weeks where individuals were not receiving their benefits. So that puts us into emergency action mode. So we opened the Emergency Operations Center. So all of a sudden, we're not on blue sky days. We're opening our Emergency Operations Center to make sure individuals that are benefiting or tapping into those CalFresh benefits have food. And again, to not just think about the Band-Aid of having a food insecurity, what we're working on now is how do we have a countywide nutrition security plan. So that's the crisis. My belief is we live in Marin County, an amazing agriculture, so many resources in Marin County. How do we make sure that we have a true system that's not just charitable giving, but there's actually some win-win opportunities. So for example, food vending, it can be controversial sometimes. There's a lot of food vending that are not licensed food vendors, but but it's an opportunity for people. They might not be licensed, but it's how they're generating revenue. It's how they're meeting their basic needs of paying for their rent is through food vending. The food is affordable. So we have food. How do we then use this as an opportunity to collaborate with environmental health services so we can provide education to food vendors about how to become a licensed food vendor, which isn't easy. I tried to figure out how to do that myself when we in San Rafael had an issue, I think it was earlier, like in June, people aren't getting licensed, so they're not receiving the education of how, again, back to communicable disease, how to prepare food safely so people don't get sick, and we don't want an outbreak. But it was really hard for me, and I'm educated to navigate the system to figure out how I would even educate the community about getting a license. So again, that's a place where it is about collaboration, and then there's such opportunities because of the relationships in Marin to actually find solutions.
So many issues. Vaccines. We've seen guidance change in our childhood vaccine guidelines in recent months. How do you view these changes, and what should parents of young children do?
I view these changes as moving quickly and not guided by science. We knew they were coming. We knew that with the election of the president and then the appointment of RFK that these changes would be coming. We've seen their plans to scale back childhood vaccinations. So what we've been doing, again, is listening. I think one of the early challenges in the pandemic was and it was because of the polarization that was happening, is that the vaccines were overpromised and underdelivered. And what I mean by that, they're very effective. But when they did talk about the vaccine, they basically said they're going to stop transmission. You get the vaccine, it's going to stop transmission. That's not even plausible from a biological perspective. There's no force field. You don't get vaccinated and there's a force field. But people were so frightened, they wanted to be reassured, and then the dialogue was so polarized. So that then when it wasn't 100% effective at preventing transmission, which it couldn't have been, then there's more doubt instilled in the community. They also understated the risks of vaccines, and there is a risk. Every vaccine has a risk. There's nothing that we take that doesn't have a risk. And as a parent, I remember what it's like to vaccinate your child and and to give a lot of vaccines. And so I've made that choice as a parent, made an informed choice about getting vaccines. My concern, and we're already seeing it, is we're seeing the return of vaccine-preventable diseases already. And so we've seen, it was just announced last week that there's another measles case in the community. We're having outbreaks across the country because vaccine rates are going down. That being said, we're highly protected in Marin County, but it's again, not a force field. So when we have a measles outbreak in one of our schools, we haven't had one yet, over 98% of our kids are vaccinated against measles. Children who have been vaccinated still could be at risk of getting a measles because of waning immunity and for other reasons. We have a mumps outbreak right now in Berkeley County. And so mumps is part of the MMR series. And mumps, when you get the mumps vaccine, it's about 80% effective. It's great not to get the mumps. There's people here that may have had mumps, but my generation, no one has had mumps. And so that's again, we're going to be seeing more of that. If you travel, we just saw that polio is wild in many countries in the UK. So there was an announcement from the CDC. I was actually thoughtful when I did ascribe it to the CDC. I had a look though. So when something comes out from the CDC, where I used to take it as truth, then I'm like, oh, let me go and see the source, because I want to make sure it's grounded. Because the CDC itself has been stripped of so many staff. Like, if you just think about the staffing levels that have been reduced, and both by layoffs and then also people leaving because they can no longer work in that environment, we just don't have the same staffing levels like we had before in the CDC. And so, for me, it's also just reevaluating before we message. So it's just, everything takes more time now.
You're right. You're right. Mental health. Oh, okay. Recent years and the pandemic especially shine a light on the need for support for mental health and social isolation, all ages. How has Marin addressed this, and what changes do you think still need to be done?
So I was in a meeting, maybe it was in February of 2020, and it was one of the first meetings we were talking about COVID, and I think it was just being called COVID, because remember it was coronavirus in the beginning. And I forget who told me this, it wasn't me, but someone said that the earthquake is COVID, the infectious disease COVID. This tsunami is going to be the mental and social and behavioral health challenges post-COVID. And that has stuck with me the whole time. My son was in 4th grade when COVID hit, and he was in school. And I was one of many that thought it was just going to be a 2-week end of school, and it was not. Schools shut down much longer. That's what I did then for many days, is how do we reopen schools. That was something I'm really proud of, was reopening schools. But my son at 9, going on 10, when he re-entered 5th grade in a virtual environment, and everyone's become virtual, became really depressed and really suicidal. And it led me to lead with much more passion about the reopening of schools. And I was like, I was a mama bear. I'm like, these schools need to reopen. And they all didn't reopen in Marin. But I was so proud of the schools that did reopen, but I saw so fast how shutting down and disconnecting was harmful. And for doctors, it's primum non nocere, first do no harm. So shutting down was harmful for many. And so that's why why the frustration with the state in June when the state introduced new laws, when we had figured it out for Marin and wanted to keep leading that way. Why we worked so hard to open those schools and keep the schools open when Sonoma was shut and San Francisco was shut. Really hard to do when your neighbors are doing something different. And why one of the even very controversial with keeping masks. I haven't talked about this publicly, but I'll share. Masks on kids. It's a complex environment when you're making policy decisions. And we were watching when Delta, remember all the waves that came, all the named waves, when the Delta wave came, we saw it behave very differently. It was a lot more contagious than earlier variants had been, and the disease had spread more quickly. in the community. And if you tracked India, there was actually a lot also more severe disease from the Delta variant as well. And one of our concerns was that teachers would not feel safe to teach if the kids were not wearing the mask. And so, and some of them have good reason. They have underlying immune conditions. They might have been older than 65 years old, which puts you at higher risk. And so that was a policy decision that was made in a broader context of how do we keep the schools open. And when we don't have, there were no guidelines. There was no like guidelines coming from the feds or coming from the state on when kids should wear masks, when kids shouldn't wear masks. And as a mom, didn't like my kids wearing masks, but for me, the goal of keeping those schools open and not, at that point, Chicago had already, there was one point where Chicago had already said they're not going to reopen, and I think San Francisco was making overtures about not reopening. So we worked in partnership, with the Office of Education about, one, making a decision that kids wear masks when they return to school, but then to start have it linked to some decision where how can we remove the masks as soon as possible so people can stay connected, so you can see the eyes and you can see the faces, so which is so critical, especially as with we call them the littles, with the kindergartners, like you learn language by seeing eyes and faces, but we also had to balance that with protection.
I remember that time very well. My grandsons were in their last years in high school. It was so devastating to not be in school.
Yeah, and that was another hard decision. Prom was another decision. Like, how do you have? There's all these things. Like, there's so many parts of this that like locked away. But it's like what we learned, and this is again, hopefully there'll be a reckoning, a broader reckoning at the federal level. What we learned was where people did get COVID. It really is in gatherings. Gatherings are at the highest risk for COVID transmission. We knew that early on. Unfortunately, before we had the vaccine and before we had treatment, people were so scared and so anxious. I was rooted to it differently, I think, than some because my family's from New York, and we saw what happened in the hospitals in New York. And my friend, who's a podiatrist, was working in an ICU. That's not healthy. That's not a healthy system if you have to tap into your podiatrist to provide hospital level care. She was trained, but not. That's a suboptimal healthcare system, and that's because New York was so ravaged. So there's still so many
Difficult
lessons
time,
there.
Yeah, I think we've learned a lot from that.
And I think, and it goes back, going back to connect. Your original question is again, we're still struggling with it, and it's not just the pandemic. For me as a parent, and not even just I think generations. Like people are on their computers more. They spend more time online. This event, I was so happy to come to this event. I'm so thankful for all of you being here. This is where you build community. When they look at the factors that keep people living longer, happier, healthier, it's being in community and sharing, being in a group together. And so how do technology advance at the same time COVID was advancing? There's podcasts and people have so much they can do inside their own head. How do we make sure that we're staying connected and hearing different voices and different perspectives, which is, again, why events like this is just so valuable for connection.
Lisa, I've got like 20 more questions. This is not going to happen because we've got great questions here from the audience. So if you still have some questions, pass them right over there. We have to go through a two-step process. Okay, so here's the first question. I don't even know what this means, so this will be a good one. Can you speak to the effectiveness of the rollout of 988? What is that? Do you know?
988.
988. What is that?
So we have 911, which you call an emergency. 988 is the number you call if you're in crisis. So you might have seen our campaigns on the buses. So there's one number to call if you're having suicidal thoughts or you're extremely depressed or someone that you know is having suicidal thoughts, you can call 988. I'm so proud. Again, what do I do every day? One of the things one of the things that we've been working on, me and my team, is working with our communications department. So on county vehicles and also on local police vehicles and fire vehicles. We don't have all of them yet in the county. You won't only see 911, but you'll see 988. And so that's just another great opportunity for people to know how to get connected when they're in crisis.
I had no idea. Thank you.
You're welcome.
Okay, you are seeing community members still dealing with the residual fear of communicable disease post-COVID. And if so, is there any effort at the public health level to minimize people's fear, especially older adults, as many suffer from isolation? And I think this dynamic is a part of it.
I think it continues with messaging. One of the better messaging that came out from the state was, I don't know if you saw, it was Swiss cheese, and there's many, many layers of protection that you can have. And so the first protection is staying isolated, right? Which is not healthy. If you stayed isolated the whole time, it's not healthy, but you should isolate sometimes. If you're really sick, you don't want to make anyone else sick. The next layer of protection is washing your hands. People don't wash their hands enough. The next layer of protection is wearing a mask if you're symptomatic. The next layer of protection, you can get vaccinated, getting tested. There's many, many layers, and I think what we've seen is people have mostly returned to not mask wearing in our country, and it's different in Asian countries where people still wear masks. And so for us, it's just consistently messaging, supporting people where they're at, and then trying to promote those opportunities where we can connect, and that it is safe to connect. So I think it's just trying to be consistent with messaging. And that being said, public health isn't good at communications in general. It's not a strength in public health, so that's something that we've been working on, trying to improve our public health communication skills and making it approachable for individuals. So if anyone has recommendations on how we can provide more reassurance, that is one of the core roles of public health, is reassuring the community, and again, by doing our job and making sure that we don't have outbreaks and epidemics, and when we do have the injection of either new or known infectious diseases, that we're controlling it so people can convene and commune together.
So what do you think about the Centers for Disease Control posting travel warnings travel warnings to put out to the world, including Spain and the UK, for the polio outbreak? What can we do if we plan on traveling to these locations? So it's a question about polio, it sounds like. And I'm assuming I had the polio vaccine, but didn't have a booster. Do I need one?
So my husband asked me that because we're going to Spain.
Perfect question.
We are fully vaccinated. And it also, with vaccines, it depends on how old you were when you started your vaccine series. Everyone has had, probably all of us here have had different vaccine series depending on when we were born and what was the vaccine available. Right now, we are not recommending a booster for polio for travel. I suspect, so there is a World Health Organization, the information, when I always go down a lot of rabbit holes. When the CDC came out with this guidance, it was on the heels of them attending a meeting from the World Health Organization, where we do have significant transmission of active polio in Afghanistan and Pakistan. That's where it's mostly located. But because we're so connected by travel, and because of just how the world is unsettled, there's just more migration happening. They have identified sporadic, based on my opinion, sporadic wild-type polio in the countries that were listed. I do not think that it would put an unvaccinated person at significant risk, but not that significant, because again, it's probably sporadically occurring. It's not at an epidemic level. So if the guidance changes, we will provide a status update on what you should do if you're traveling to Spain. And I'm up to date in my vaccine, so I won't be getting a vaccine.
Perfect. Okay, this is a question that's near and dear to my heart. Okay. What is the County of Marin Health and Human Services doing to ramp up to meet the needs of the growing older adult population in this county, which is fast growing, about 30% over the age of 60. And currently, Marin County holds the the designation of the highest number of older adults, I think it's most likely the percentage of older adults in all 58 counties in California. Thank you.
Yes. This is another place I'm excited about, and Janae Cottrell, our Director of Aging and Adult Services, is here. You're getting hot off the press, so she will be bringing to the board a recommendation to develop a master plan on aging for our community. It'll be the first time we have a master plan on aging for our community. There's a blueprint for doing that. The state has a master plan on aging, and many other counties have followed suit to develop their own plan. I've learned if you don't have a plan, we all move in very well-intended directions, but not necessarily in concert together, and not understanding who's responsible for what. There's many different lanes of healthy aging. So for example, affordable housing is one lane, social connectedness is another lane, access to healthcare is another lane, caregiving services. So healthy aging is very complex. We're all lucky to do it, right?
Hopefully.
We're all lucky to be aging.
Yep.
And in Marin, we definitely need to double down our efforts on doing that. So I think we have an exhibit right now focusing on aging, because again, sometimes it can be unseen. Many people, as they age, feel that they're not seen and valued in our community, and so I think this is an important next step. There was a plan that was previously published. It was the Integrated Aging Study, and a lot of that study aligns directly with the master plan on aging and what we need to focus on. So how I always see when there's an opportunity to align with this, like an approach already set by the state, then we can amplify our efforts much more quickly. But it's challenging, especially for people without insurance, people who have, many people don't have full scope Medicare. We have a Medi population, and what probably concerns me the most is people haven't engaged in the financial planning that they need to ensure that they can keep their home and their way of living, and the additional supports and services that they would need to live independently. Probably most Americans, I think the data shows most Americans haven't really engaged in the retirement planning and advanced life planning from a healthcare perspective or from a fiscal perspective. So that's what's probably most worrisome, because one of the conversations that we were having last week, we were meeting about the Master Plan on Aging and talking about that last week, was the number of individuals who are newly homeless. They've never been homeless before. They're 70 years old, and because of life circumstances, they're becoming homeless for the first time. And we don't have the supports. That's an extreme. It's not where everyone is, but that's a reality that I've seen personally in some of our encampments, and it's a reality that we're seeing in our emergency homeless shelters. Back in the day when I worked in Santa Monica, the homeless shelter was a day, almost like basically a night program. People were ambulatory, they were coming in and coming out. It was a younger population. About 50% of Homeward Bound's emergency shelter at Jonathan's Place and at New Beginnings are individuals over 70 years old, and also with advanced healthcare needs. They really should be in a board and care or an assisted living facility. We don't have that for individuals who don't have means. We do not have affordable assisted living. So we have this in the continuum of care. We have major gaps that Marin should be, and this is the beauty and the frustration of Marin. Marin is that perfect size of 250,000 with all of the assets that we have. These are problems that we should be able to solve and make those investments. Without a plan, though, people often will go in their own well-intended directions, and then we're not synergizing and harnessing. So lots of work to do.
There was a question earlier. We didn't quite get to all of it, but it asked about isolation in older adults. Is the health department involved in any efforts to try to, there are a lot of people who are living all by themselves in their homes that are isolated.
The health department's not directly involved, but our Department of Aging and Adult Services is involved, and through programs like the Meals on Wheels program is probably one of the most important programs for social connectedness, because sometimes those are the only people that live at home alone sometimes see are the people that are visiting their home. So I think there needs to be a lot more of that in Marin County, and I think that's that would be the value of having a master plan on aging that has one of the core focus areas being social connectedness. How are we making sure we're connecting to older adults? Faith-based organizations are outstanding in this space. They often know their congregation. They have volunteer efforts to connect to individuals, but not everyone is connected to a congregation. But
Yeah.
and again, and that's where I think it's that, how do we create that quilt where for some individuals are connected, they're connected through their faith-based organization. How do we make sure the faith-based organization knows about Meals on Wheels and other programs that could be beneficial? So how do we information share so we can optimize everyone who is living alone in our community?
It sort of goes back to that issue of collaboration where public health really depends upon our nonprofits to work in collaboration and faith-based organizations.
Oh,
and
absolutely.
educational institutions. And
We just got accredited, and one of the things that I was proud of in the report on accreditation is they highlighted what we've called radical collaboration. During the pandemic, we worked differently. We had to work with every community-based organization, every small business, every large business, and we tried to create the doors and line of communication as open as possible with those organizations, because that's how we shared information to reassure individuals that yes, you can go to church, and how can you go to church safely, for example. Yes, you should send your kids to school. It was through those communication networks and really collaborating with those partners. And after the pandemic, we didn't want to lose that. So the infrastructure that we kept afterwards is called community resiliency teams. So throughout we have 5 zones that we've created. They'll make sense to you. We didn't create it. They align actually with our fire protection zones. So Novato, San Rafael, Central Marin, West Marin, and Southern Marin each has a lead community resiliency team that is working to connect with public health and make sure that we're sharing information. So again, we work closely across health and human services. Social services attends those meetings and you sees them as networks to share all the information. And that's the beauty of Marin, is that web of network that we have with community-based organizations and faith-based organizations.
right. Public health is complex, huh?
It's complex.
And interesting, and it's definitely more than meetings, that's for sure. I want to remind people that there's an evaluation that's important for you to fill out. It really helps Westminster events really improve and continue to be able to offer these great events, so please do that. I want to let you know that Lisa is going to be here in the beautiful reception area, so please join her if you have questions that didn't get answered. I'm sorry we weren't able to ask all the questions that came up with the group. They were really good questions. And I want to thank everybody for being here and invite you to leave the room after you do your evaluation and go to the reception area and join us. As they said, there is lots of food. Please let's give Lisa a hand.
Thank you, Terry. You're an excellent moderator.
I just want to say, I really, there's so much to learn in public health, and it's wonderful that we in this county have a health officer as marvelous as Lisa, who's accessible and available and always listening to hear what the community wants to know. So please, one more time, let's give her one more hand. Was that okay?